Okay, we are now live.
Welcome back, guys. We're going to do another question and answer session. Yeah, fire away. We love doing these. Hopefully we are providing some kind of education out there.
Yes, absolutely. All right, so to start off, I have Jen D _JD 2004 asking, will too much visceral abdominal fat compromise the results of a plus-size tummy tuck?
Yeah, so visceral fat is fat underneath your abdominal muscles. It's on your organs. So from the surface to the depth, you have skin, subcutaneous fat, layer muscle, then organs, and visceral fat. Visceral fat, intra-abdominal fat, all means the same stuff. It's this fat over here. And I can't do anything about that, right? Because it's on your organs. So if you have a lot of that, it will prevent me from making your abdomen as flat as maybe you would want me to, or that I would want to. Now, the good news is that you can still get a tummy tuck, and then you can then continue to decrease your intra-abdominal or visceral fat, and that will just decrease and flatten down with time on its own.
Right, so next question, we have Kennedy Jakes. She would like to know, what are the implant options for breast augmentation?
Well, the first decision is saltwater filled implant, which is saline implant, versus silicone, right? So that's like the first fork on the road. And then once you go into either one of those, then there are a variety of different characteristics of each. So you have smooth shell versus texture. You have, low, medium plus, high profile, ultra high profile. That just means how much the projection they have. And then they also have different types of fill, like regular fill, extra fill, boost is one of the types of implants from one of the manufacturers. But the main ones are really saltwater filled, saline versus silicone. So that's the main types of implants.
All right, I have H _Mendoza asking, do you do paniculectomies?
We do paniculectomies. We do paniculectomies, of course, tummy tucks, plus size and non-plus size tummy tucks. So paniculectomy is usually just removal of the tissue that overhangs your pubic area. There is no dissection up beyond that. There's usually no liposuction, and there's no repositioning of the belly button.
All right, and then I have BombBomb _Aguera, and she would like to know, I am 250 pounds. Can you give me a tummy tuck?
Well, so we have no BMI or weight restriction, and so if we can do things safely and effectively, then we're going to go ahead and do so. The biggest component is, is that 250 pounds on your frame in an area that we can do something about, right? So, and also the other thing to consider, 250 pounds on a 4-foot tall person is totally different than 250 pounds on a 6-foot tall person. So the weight doesn't really communicate a lot. Chances are we can probably do a tummy tuck without issues, as long as your health is fine, and as long as a lot of that fat and 250 pounds worth of weight is extra abdominal fat on top of the muscle.
And then Kim Rice DT would like to know, can you use your belly fat for breast reconstruction?
You can, yeah. You can use a fat that's throughout the body for fat transfer to the breast. Absolutely.
All right, and then Chica74 would like to know, she says that she's seen your amazing work, but she notices that after a tummy tuck, most stomachs can sometimes look like not as flat, especially with plus size. Does the swelling eventually go down?
Yeah, swelling eventually goes down, but you have to also remember, depending on the person, you have to have the blood supply from somewhere, right? So you can't do anything about intra-abdominal fat. We talked about that. Swelling does go down, but even for some patients that are not in those categories, you have to keep some of the blood supply to the tummy. So some patients we max them out in terms of tissue removal, dissection, liposuction, but you cannot liposuction as much as maybe you'd want everywhere, because you have to keep a little bit of blood supply in specific areas to prevent wound healing complications. So the good news is that once you go through that process, you can always do a little extra touch-up liposuction if you need to at a second stage.
All right. Ashley _White would like to know, should you wait until after having children to get a tummy tuck?
Well, that's a good question. So it all depends on when you're planning to have kids, because let's say you lost a bunch of weight, you gained a bunch of weight, but then you lost a bunch of weight and you're 25. But you're not planning on getting married until 35 and maybe have kids at that point. Are you going to wait 10 years, then then have kids, then have a tummy tuck? Totally reasonable to do so. But some people don't want to wait 10 years with loose skin. They just want to have a tummy tuck now, enjoy their life, get married, have kids, and then if after kids they need to kind of touch up the tummy tuck, then they do so as well.
And then Rosie Montero would like to know, can you speak a little bit about inner thigh lifts? What does the process look like, and who is a good candidate for that procedure?
So everything in plastic surgery in terms of body contouring is determined by how much loose skin there is, right? And so when we talk about thigh lifts, then we have to say, well, what kind of thigh lifts can we do? Meaning, where can we put those incisions? So classically, the two most common types of incisions for a thigh lift is a growing crease incision. So that goes kind of in between where your thigh meets your pubic area. And then one that's kind of a full inner thigh lift, basically a vertical incision on the inside of your leg from your groin all the way down to your knee. As you can see, the second option, the full thigh lift, has a longer incision and therefore is able to correct more skin laxity and throughout the thigh. So it's a much more powerful procedure, but at the consequence of having a longer incision that's visible below your shorts, right? And so some people want just the inner thigh incision, a growing crease incision. Sometimes it's called a crescent thigh lift, which is totally fine, but it can only correct a certain amount of skin and only in a certain amount of area. So you have to look at what your skin's is in terms of your thighs, where it is, how much loose skin you have, and how much correction you want. And then you have to accept the type of incision that will give you that result.
The Linda Baca would like to know, how soon can you get up and walk around after a plus-size tummy tuck?
Well, we want you to get up every hour to use the bathroom after a tummy tuck. So that's good for your blood flow, but it's also consistent with being properly hydrated.
Right. It's Me, Sophie would like to know, is it true that after you get a BBL, you can't lay on your back or sit down?
Well, I don't know if that's 100% accurate because we do a combination of tummy tucks and BBLs and they have to lay them down on their back. And the BBL results have healed great. So I don't know why there is a little bit of that concern about compression of the buttock fat transfer. Obviously, you don't want to lay on your back for hours and hours and hours or sit on your buttock area for hours and hours. But if you're getting up consistently, if you have nice good padding underneath that, then you should be able to sit some or lay on your back some.
Tiz_Rig would like to know, is 4 weeks post-op too soon to travel back to Europe after a plus-size tummy tuck?
No, I mean, we have a lot of, so the answer is it's fine. We have a lot of out-of-state patients or out-of-country patients, and they usually can only stay here for 2 or 3 weeks. So obviously, they're all traveling back to a different state or different country. And as long as you do all the things we tell you while you're traveling back home, you should be fine. So 4 weeks is totally fine for a plus-size tummy tuck travel back to wherever your home is at.
Trisha H1 would like to know, is there any permanent numbness after a tummy tuck?
There can be, yeah. Right above the incision, right above the pubic area, there can be some permanent numbness. It's variable. Some people end up not having any, and some people do have some. It takes a while to know how much that's going to be there, because in the beginning there is always numbness right after a tummy tuck, and then the numbness just gets better and better and better, and sometimes it goes away.
And then Rosie_Monreal Ruiz would like to know, what does my BMI need to be a good candidate for surgery with you?
Well, a BMI is only height and weight, right? That's the only, it's a number that calculates those two other numbers, right? And so that doesn't really tell me anything, and therefore I don't really have a BMI or weight restriction. Because if you told me a very high number, a very high BMI, we might still be able to do a good surgery and do so safely. So we've consistently done 50s and 60s in terms of BMI, and we've done great. But it's possible that you can be a BMI of 35 and not really be a good candidate for surgery because of heart, lung issues, diabetes, things of that nature. So in general, we look at patients that have stable medical conditions, right? So if you have controlled hypertension, that's totally fine. Controlled diabetes, that's totally fine. And your BMI and your weight, it's not really that relevant as long as we can get a good result and we can do so safely.
And what is the highest BMI that you've worked on in the past?
Now it's in the 60s. We used to say 52, 54. Now it's 60s. I think we did a 62 recently. And next week or the week after that, we have a 70 BMI. So that will be our new highest BMI.
All right, and then Emerald Isle Studio would like to know, she's never been under anesthesia, and that's like the main concern before moving forward. She wants to know, what are the most common risks and how common are they?
Well, anesthesia-related complications are very rare, and especially if a good anesthesiologist. So we have a board-certified anesthesiologist. His name is Dr. Link. He's excellent. Up until today, we've never had an emergency transfer to the hospital, but one of our patients today had what's called new onset arrhythmia. Basically, their heart electricity beats a little differently, and that can happen to anyone at any point. It might have been irrelevant to surgery. So she's doing fine, but for precaution, we sent her to get evaluated at the hospital. But as you can see, 15 years in practice, that's if you do things properly, if you have the right team in place, safety should be very supportive of having surgery. So far, I would not be worried about anesthesia-related complications.
And then does having a higher BMI affect those complications with anesthesia?
Not necessarily. So sometimes if you have a very high BMI or a higher BMI, it can impact a little bit of the airway in terms of how you're seeing it, but not necessarily, because that's more architectural, structural. So you just have to have a good anesthesiologist, you have to have good protocols in place, a good team to position the patient, things of that nature. It shouldn't be. Now, if you do a regular kind of a, quote unquote, normal BMI patient, and you do the same procedures for them as you do for a high BMI patient, you can start seeing some complications. And that has been shown in studies from the 80s, and that's why people keep quoting that, However, if you modify how you do things, if you modify how you teach patients, how you instruct them, how you guide them, how you do your surgery, then you can have just as safe and just as an effective procedure for a high BMI patient as do for a low BMI patient.
And then Chica 74 would like to know, can a tummy tuck, breast lift, and lipo 360 with fat transfer all be done at the same time?
They can, yeah. I mean, we do 8, 9, 10-hour surgeries all the time, and they've all turned out fine so far. That shouldn't be an issue. As long as you're otherwise in good condition, that should not be an issue.
And then Jessie Rayon would like to know, do most patients require liposuction with a tummy tuck, or is the tummy tuck enough to get your desired results?
I include liposuction to the abdomen and sides of the abdomen with all my tummy tuck because I think it provides a better result. If you're lost a tremendous amount of fat and you're basically just nothing but skin, then technically you don't have to do liposuction. But most people have some amount of fat that benefits from a little bit of liposuction.
And then Lovable Leo 1 would like to know, I have lymphedema and lymphedema in my legs with varicose veins. Is it okay to still have a leg lift and the removal of excess skin? I've lost a lot of weight.
Well, so I've done a couple patients before, they did great. However, you want to make sure that your lymphedema is properly controlled. The varicosities or varicocele veins are not really an issue, they're more superficial. It doesn't necessarily help your lymphedema, like the surgery doesn't improve the lymphatics necessarily. And so the only thing, it depends on the severity of both of those things. Sometimes you want to stage it a little bit where you do some liposuction to thin things out, let it heal, and then do a skin removal. So if the lymphedema and lipedema are very bad, we may want to back off on how aggressive we are and may potentially do it in 2 stages. So just something for us to look at and consider.
Eduardo Ramos would like to know, can you get a second round of tummy tuck if you want a more snatched waist and flatter stomach?
Yeah, you can redo the tummy tuck multiple times. The most difficult part of a tummy tuck is when somebody removes too much skin and then the scar is too high or things of that nature. But if there's still loose skin there, then you can redo the tummy tuck.
Jordan Keller Matthews would like to know, when can a patient take a full shower after a plus-size tummy tuck and arm lift?
Theoretically, there's no problems. As long as all your incisions are closed up, you can take a shower at any point. I usually recommend to my patients to wait until further down the road, a couple weeks or more, just because the more you stay in the compression, the faster you'll heal. And by taking a shower, you're taking compressions off and things of that nature. So I usually say defer the showering for a while. It's usually in your best interest in terms of the rate of healing.
Garrett Colette _ would like to know, what is the difference between a drainless tummy tuck and drain-ins?
Well, so obviously, and I'm not being facetious, but the difference is one has a drain and one doesn't. But in terms of technical stuff, could be very much the same thing. So if you do a drainless tummy tuck, you should put more quilting sutures underneath to tack the tissues down back to the muscle. But even when you do so, if you still leave a drain in there, you'll notice that the drain still puts out fluid. So it's interesting. I think the body always creates fluid, and I think it's good to have some drain in there. I think if you put a lot of quilting sutures, the drain stays in there a little less. So I'm a big fan of putting a drain in there. Worst case scenario, you put a drain in there, and after a couple of days, let's say the drain stops putting out fluid. Great. We'll take the drain out. We haven't lost anything. If anything, we just help the body heal a little quicker in the first few days. But I've put a lot of quilting sutures and I put a drain in there, and sometimes the drain still cranks for a week or two. It all depends on how much liposuction you're doing. So you have to remember that if you do aggressive liposuction and you put a drain in there, your drain's still putting out a lot of fluid. And there's no empty spaces there. It's not like you're putting quilting sutures in there or anything like that, right? So it just goes to show that even with non-dissection tissue, like just liposuction, a drain is still beneficial. So I like a drain with a tummy tuck. I think it's helpful.
Veronica Avad would like to know, can I be a candidate for a tummy tuck and liposuction if I have chronic diastolic condition?
Well, if your cardiologist clears you, that means your cardiologist will say, hey, your chronic diastolic condition, whatever that might be, is not an impact on your current health, and it should not impact you during surgery or recovery. And if your cardiologist signs off on that, then we're good to go.
And then Jordan Keller Matthews would also like to know, for muscle application, do you use dissolvable sutures?
You can use dissolvable or permanent. There's pros and cons to both. It depends a little bit on what your preference is, but they're both available.
And then _Nashita would like to know, how many hours does the tummy tuck take?
Well, that's dependent on how tall the person is, right? How wide they are, and then how much fat you have to do in terms of liposuction. So if you're doing, 8 liters of liposuction, is going to take a lot longer than if you're just doing 1. Usually a plus-size tummy tuck is about 4 hours.
G. Bailey 203 would like to know, what about patient age? Is there a max age that you will operate on?
No, we've had patients in our 70s and we've done tummy tucks and breast surgery, back surgery, facelifts, of course. So there is no, as long as you're healthy, age doesn't really make a difference.
Nettie _Myers would like to know, how long do you have to wait after a tummy tuck to drive?
Well, we usually tell people, when you're recovering, don't do anything you don't have to, right? So if you have to drive to go to an important event, because you can't miss that because it's like an important work thing or an important life event, then maybe that's what you have to do. But if you're doing that to, do things that other people can help you out with, take the kids to school, run errands, go get groceries, that kind of stuff, then you shouldn't do that. The more of that you do, the more energy you waste on that stuff and away from your healing.
Mm-hmm. Ellie Edwards Jonas XO would like to know, what is the difference in Lipo 360 and a bra and back lift with tummy tuck?
In my hands, liposuction 360 is liposuction around the waist all the way around, right? So that's liposuction of the waist 360. When I do a tummy tuck, I include liposuction of the front, and when I do a bra line back lift, I include liposuction in the back. So you're getting liposuction 360, but you're also removing skin. Liposuction 360 by itself does not involve any skin removal.
Glenda J would like to know, does a plus-size BBL include filling in any hip dips?
Yeah, when we do buttock fat transfer, we look at the butt and the hips together. So it's we discuss where the fat goes, how much it goes, what kind of shape, what kind of width, what kind of projection. And so all of our quotes are not, term-based, So when you say buttock fat transfer, you have to say, well, how much buttock fat transfer? Where do we get the fat from? How much liposuction are we doing? Where are we putting it, on the buttock area and the hips? Because all of that determines the amount of time in the operating room. And the amount of time in the operating room is what determines the quote or the price.
Sierra Babiera would like to know, if someone is wanting a total body lift, is there a preferred procedure that you would use?
Well, so a total body lift can be a lot of different things, right? So we have to look at it in pieces. So for example, let's say the abdomen has loose skin. Well, then you have to do a tummy tuck. And then let's say your buttock area and hip area, back of the leg area is loose. Well, then you do a lower body lift. So basically the incision for the tummy tuck continues into the buttock lower back junction. So that at that point you're doing a lower body lift. But then let's say you also have loose skin in the bra area. So then you have to do a bra line back lift. Well, then you're doing an upper body lift as well. So you're doing an upper body and a lower body. And maybe at that point you call it a total body lift. But maybe some people say, well, no, you also have to do arm lift and you also have to do thigh lift to do a total body lift. So it depends on how you define it. So it's much better to look in the mirror and just say, this is what bothers me. What should we do to correct that?
It's me, Sophie, would like to know, how do I get a normal looking belly button and not a coin slot one? Can I get a tummy tuck with hernia mesh that has been placed, removed?
Yeah, when I do tummy tucks, and if there are hernias there, we should fix them. If there was mesh placed and you want that removed, that's a good time to remove it as well. So you can do a tummy tuck, hernia repair without mesh removal. And then the shape of the belly button is, a lot of it is determined on your plastic surgeon. So you have to discuss that with them and discuss exactly what kind of belly button shape you want. And far and few between, there are some patients who have a belly button stock that's really in a certain shape that prevents us from doing different kind of belly buttons. But that's very rare. Most of the time you can get circular, oval, a little bit bigger, a little bit smaller. You can do a lot of different types of belly buttons.
Right. And then Hair Room by Janet would like to know, I'm pregnant and having a C-section in June. How long after do I need to wait for a tummy tuck?
Well, I would wait until your body has stabilized, right? So until the skin has contracted, maybe some of the, water retention from pregnancy and things of that nature goes away, and you just feel like you're kind of stable. Because if you do a tummy tuck earlier, you might be putting the tension on the skin to a certain amount, but maybe your skin's still kind of contracted, right? So you might then have some residual areas that are not treated appropriately. So I'd wait at least 3 months, maybe longer, just to get a little stability in your life,
Cake Lady 17 would like to know, can a tummy tuck ever be covered by insurance as part of abdominal repair?
Well, a tummy tuck is not an actual medical word. The actual medical word is an abdominoplasty. An abdominoplasty is described by the insurance companies as a cosmetic procedure. So by definition, abdominoplasty, which is a tummy tuck, cannot be covered by insurance.
And then JD_JD2004 would like to know, are there any metabolic or health benefits to getting a tummy tuck?
Yeah, some literature that's coming out now is looking at any kind of fat removal, whether it's a tummy tuck or large volume liposuction, has some physiologic benefits. We used to think that fat was kind of static or dormant, just a repository for excess calories, but there are some interactions with our physiology, hormone conversion and things of that nature. So there are some benefits to removing those excess fat cells, and that part of those benefits are probably also what we see when we lose weight naturally, because those less fat cells, not less fat cells, but less fat in those fat cells.
And then Cindy B would like to know, will my stretch marks be gone after getting a tummy tuck?
Any stretch mark within the tissue that we remove as part of a tummy tuck will be gone. But if they're outside of the tissue that gets removed, then they'll still be present. They'll just be in a slightly different position.
Katie Rosiana would like to know, what is a breast lift and does it always include implants?
No, a breast lift should not address implants automatically. So you can do a breast lift with implants or you can do a breast lift without implants. But a breast lift by itself is just shaping the breast tissue. That's all it is. It's not adding volume and it's not subtracting volume.
Dats DZ would like to know, how do you treat patients that have diabetes?
Well, I don't treat the diabetes myself. What we do is we want to make sure that their glucose control is stable and controlled prior to surgery, because then surgery tends to stress the body out a little bit, and if your sugars are not controlled properly, they're going to spike up even higher afterwards. So diabetes is fine as long as it's controlled appropriately for the kind of surgeries that you're having. If you're having a small surgery, a little bit looseness on the control is okay. If you're having a big surgery, then you want your control to be pretty good.
Ari Liu 26 would like to know, do you do lipo and body makeovers for males, and what is done differently?
Yeah, we do. I would say maybe about 20% of our patients are males or so, something along those lines. It all depends on what you're trying to accomplish, because there is a classic male shape and there's a classic female shape. But of course, everything in between, people have different preferences, right? So the classic male shape is a more square trunk, and the classic female shape is a more rounded, like not rounded, but like hourglass shape. However, there are women that want less curvature, and there are guys that want more curvature. So the key is the surgeon and the patient have to have a good discussion and a good understanding of what the goals are. And then you have to provide those contours.
And then baby Momshi would like to know what causes dog ears with certain patients.
A lot of it is geometric design of the tummy tuck. And so that's basically it, right? So you have to design the tummy tuck properly, and you have to understand the limitations of the tummy tuck. Sometimes people try to pull in skin and address skin that's beyond the tummy tuck. It's in their lower back, basically. And you can't do that without distortions of the skin.
And then Julieta Recco would like to know, do you do neck lifts, and how is it done? Where would the incision be made?
A neck lift, yes. So there's lots of different types of neck lifts as well. The classic neck lift incision is earlobe back into the hairline, right? It's best done with a combination of a facelift as well, where the incision also goes in front of the ear, inside the ear, and then matches up the sideburn. So those two incisions together, they're well camouflaged and well healed, but it gives you access to this whole area. And that's important because the neck tissue is contiguous with the face tissue, and if you pull from both, you pull in multiple directions and with a broader pull, so it's better. Some patients also benefit from an incision here. That allows us access to the muscles in the center to tighten them. It also gives us some access to the fat in the area. It also gives us some access to the submandibular glands and some of the musculature in the area.
And then Charisma's Magana would like to know, do you need a breast lift and a reduction, or will one benefit the other?
A breast lift shapes the breast that you currently have. A breast reduction is a breast lift that also reduces the breast.
Can the size be changed when you're getting a breast lift?
Well, if you're getting a breast lift by itself, ideally your breast size should not change. If you're wanting your breasts to become smaller, you're really asking for a breast reduction. A breast reduction includes a breast lift.
And then Nashita would like to know, I have ovarian cysts and PCOS. Does that affect me from getting a tummy tuck?
No, those are all internal in and around your uterine area. And so that's deep underneath the muscles and does not affect the tummy tuck area.
And then Marstella Rock would like to know, have you ever operated on patients with mobility issues? Post-COVID and a long ICU stay, I am regaining my strength still. Is surgery an option for me?
It can be. We have to take a look at what your restrictions are, what your lung functions are, what your mobility issues are. We've done breast and tummy surgeries on people that were paralyzed from the waist down, so obviously that's not an issue there. But the lung function and the heart function are important, and so we can dive into that during the consultation and try to figure that out.
Coco Nugget Sound would like to know, will abdominal skin retract after liposuction if there are moderate stretch marks?
Well, we don't know how much it will retract. Neither you nor your surgeon can predict that. Now, if you're 20, as an example, and your skin has no stretch marks, and you've never had a huge weight fluctuation, chances are your skin's going to retract great. If you're 80 and you have a lot of stretch marks, and you've had a lot of weight fluctuations, chances are your skin's not going to retract hardly at all. And of course, most of us are somewhere in between. And it's hard to know exactly how much, but more importantly, it's also hard to know how much skin retraction you'd want to be happy. So if you're not quite ready for a tummy tuck and you think liposuction is good for you, then just do that, knowing that if your skin doesn't retract sufficiently for your satisfaction, then you'll have to pull the trigger on a tummy tuck.
Victoria Bellin 620 would like to know, how much is a consultation with you? I'm from out of state. Is there a virtual consultation option?
Yep, we do both virtual consultations and in-person consultations, so whichever one works best for you. Our consultation fee is $250. That does, however, get applied to your surgery if you end up having surgery, so you're not actually paying anything if you end up having surgery.
And then as we close out, do we work with any financing options?
We use Patient Fi, we use Care Credit, we use Alphion. Those are the three main ones that we use. And of course, you can always make prepayments to your account ahead of time as well.
And where are we located?
We're located in Scottsdale, Arizona, about maybe 10, 15 minutes away from Phoenix International Airport. We're in the kind of the downtown, old town, Scottsdale area, kind of where all the restaurants and hotels and bars are at.
Mm-hmm. And then after your consultation, about how far out are surgeries?
It varies. You know, we usually book about 2 or 3 months out. We've booked as far up as 6 months, sometimes where we just kind of get an influx of a lot of patients. But usually we're about 2 to 3 months out.
All right. Well, thank you very much, Dr.
Thanks,
Repta.
guys. Appreciate it.